Ali Parsa, founder, CEO, Babylon. Babylon, we try to figure out a way to make healthcare accessible and affordable to every human being on earth and put it in the hands of every human being on earth. And so therefore the question is, what is healthcare? And if you think about most of your needs in healthcare, it starts as something as very simple as, I have a symptom, can you triage it? Do I need to see a doctor, can you diagnose me? Do I need to do a set of tests, can you deliver that to me? Do I need to see a specialist, can you help me to see that and manage my healthcare? And it's that end-to-end solution, getting away from silos, integrating it all on a device you already have, your mobile phones, is what we do. Well, the gist of it is technology is now moving so fast, be it in diagnostics where it's becoming almost free, to information which is already free, to mobile phones that are already in everybody's hand. We are becoming more and more capable to bring the technologies together that solves our healthcare. The bottom line of what I was saying is that we are on the verge of being able to make healthcare affordable, accessible to every human being on earth. We can do with healthcare what Google did with information, and we should absolutely focus on nothing else but that. Ambition. The challenge we have, the biggest challenge we have is ambition. We're trying to make incremental little changes to the existing system. And I can think of no industry, never in history, in no sector, where the existing incumbents with true gradual innovation have disrupted and created something massive. Why does a youngster create Facebook? Why does another one create Google? Why didn't the big giants of the industry do? Because they were so engaged in what they were doing at the time. It takes to unshackle all of those. So we should have the ambition to be the founders of future. Figure out what the future will look like and then go build it, as opposed to founders of feature, which is how can I incrementally, just tiny, improve what exists today. So I think it's very important to remember that the flat part of an S-curve is flat. It's not going to go exponential anytime soon. It took a very long time for Google to go exponential, right? Years of research development, and eventually it worked out, right? And that's what we need to be focusing on. We need to focus on building products that people need, and therefore they will use. When we just answer questions for people, when we did just consultations, we did 50 a day. When we answered questions for them, we did 200 a day. Now that we do triage, we do thousands a day. And when we do diagnostics, we will hopefully do tens of thousands a day, because that's what people's needs are. And eventually, when we can figure out how to keep you at the peak of your health, rather than wait for you to get sick, before we can bring you back to be healthy, that's where millions of people use it. We need to have the products, the services that people need. People will always come and seek their needs. We can't sell them what they don't want.